right, so we're still under the innovation in fetal medicine, and to take us through proposed use of QR code linked digital records for fetal ultrasound scans, the FETO Sync AI is none other than Ms. L.A. NDLOVU. Can we put our hands together as she takes us a journey through that?
Okay, good morning, ladies and gentlemen. My name is NDLOVU, and I'm a student at National University of Science and Technology, Zimbabwe. So I'm going to take you through this innovative topic called FETO Sync AI. It is a QR code-based platform for secure antenatal ultrasound record management. So the name itself says FETO. It stands for Fetal, which points us to that it is prenatal care based, and then Sync stands for synchronization of data, which means that it will be linking patients to their ultrasound records throughout the whole pregnancy. So the background of the study, we are saying that all pregnancy matters. If it didn't, then we wouldn't be here today. So antenatal ultrasound scans, they monitor fetal health during pregnancy. But many Zimbabwean health facilities will still use paper-based records. But the disadvantage with this traditional system is that paper-based records, they are prone to loss, they are prone to damage, and also papers are bulky. So when these records are lost, then the patients will then have the problem of inconsistent documentation and poor follow-up. And this is a major problem when we are concerned with high-risk pregnancy. So there is therefore a need for integrating a digital tool that enables digitization and automation of ultrasound reports. Also, since there is an increase in use of mobile access in Zimbabwe, and also since there is an increase in use of mobile access and technology, we therefore have to also digitize and automate our ultrasound data management. So as I've said that paper-based obstetric records are prone to damage. There's inconsistent follow-up and communication among care providers, which leads to jeopardized continuity of care, especially in high-risk pregnancy. Then our current systems, they also lack real-time syncing and standardized reporting templates. So the objectives of this study, we want to develop a QR code-driven digital platform which links patients to their ultrasound reports throughout the pregnancy. The innovation will be designed in a way that upon the initial visit, which is ideally at the first trimester, the patient will visit a healthcare facility, and then proper patient history is taken. And then it will be recorded within the app. And then when the sonographer does their scan, after doing the scan, they record their findings within the app. So within the app, we want to put structured fetal medicine templates, which will serve as a structured guide for sonographers, which will serve sort of like as a checklist as to why they are doing that pregnancy. And we also want to promote uniformity within prenatal care in multiple facilities. So as Dr. Verenka yesterday mentioned, that ultrasound mustn't just be taking a probe, measuring fetal biometry, checking the gender of the fetus and viability. But these scans must serve as a proper tool that the doctors will have to use in order to provide proper care and to improve decision-making. So another objectives of the study, as I've talked about, support of standardized fetal medicine templates within the app. We want to enable real-time data syncing such that after each scan, the first scan is recorded into the app and the data is stored securely into a cloud-based system. So even for the subsequent scans, the data will also be stored in that cloud-based system, such that as the patient will go to the next facility, we will be able to easily access the findings, comparing the previous scans, the history, the previous scan reports with the current findings. So that will be enabled by the QR code system, such that the healthcare provider will scan the QR code, which will link him directly to the previous scans, the patient history, and the full information that is associated with that pregnancy. So that QR code will be valid throughout the 9 months of the pregnancy, throughout the whole duration of the pregnancy. So this facilitates patient-centered communication in such a way that with the FETO sync, there will be a built-in alert system which will remind patients of their due follow-up scans, especially with the high-risk pregnancies. So it will be sending them the dates for their next follow-up scans. So the objectives is to plan for development, piloting IT governance, and sustainability. So the method, we want to develop the minimum viable product, and then we integrate fetal medicine standardized templates. And then we also put a built-in alert system. So the system will be designed as a multi-facility application in a way that within the app, you can be able to see which other facilities support FETO Sync AI is the referral, so that continuity of care is streamlined. So all the phases of the development of this application and user feedback will be done in a period of 8 months. So the expected outcomes, as I have indicated earlier, we want to target all pregnant women, but for the minimum viable product, it will be piloted in 2 to 3 sites where we'll be targeting at least 50 to 80 pregnant women, and access the usability and also feedback from the midwives and sonographers who use this app, and also how the patients are adopting the innovation. So as the plan is to transform prenatal care with FETO Sync AI, we are not entirely doing away with paper-based ultrasound reports, but we are introducing a hybrid tool whereby we will, yes, after the sonographer does the scan, they will still do that full report and give the patient the report. But there will also be a QR code by the corner of the report, whereby the next healthcare giver can be able to scan that QR code and then access the previous reports and the full patient history. And then the support of standardized templates, I talked about it, automated reminders, full pregnancy, scan history, and then the ultimate objective is to improve care through real-time syncing and alerts. So the limitations and considerations of this innovation is that for the hospital system, it requires stable IT infrastructure. And then the initial development and training costs may be high. It is dependent on smartphone and WhatsApp access for patients, where they'll be receiving their alerts for the next follow-up scans. Data privacy and security must be strictly managed. Then user adoption challenges and sustainability depends on funding, policy support, and long-term maintenance. So my conclusion is that FETO is more than just a digital tool, but it is a response to the critical need in our healthcare system. By enabling secure, accessible, and continuous tracing of ultrasound records, it supports more accurate diagnosis, better referral systems, uniformity within health facilities, uniformity of prenatal care within healthcare facilities, and timely interventions. So ultimately, this can contribute to significantly reducing fetal and maternal mortality and morbidity by improving decision-making throughout pregnancy care. So we believe every pregnancy deserves the best chance, and that is why FETO is a step towards achieving that reality. So the call to action is you can fund, partner, and offer pilot site access of this project, which will help advance maternal care with digital tools. Thank you so much. Any questions?
Right, so thank you, Lanisha, for the presentation. You can just go stay here. So this is still a proposal, right? Yeah, so probably can have input to make it better or scrutinize it.
I did not raise my hand, but you just gave me the microphone. Anyway, thank you very much, Angela. This is a good presentation. I just want a clarification. You said was it on your conclusion when you said this app will allow us to retrieve the previous scans? The scans that we use right now has got an option of history, whereby you can click and enter the patient's details, and you get all the previous scans of the scanning records of the patient, and even the pictures. Is there anything different that this app will be offering? Thank you.
Okay, so with this app, we're saying that some patients, they change from one facility to the next, but we, from time to time, will face challenges whereby their data don't follow them as they move from facility to facility. So we find that maybe the patient did their first trimester scan at Lawayo, and they leave their records there. Then it is now second trimester, they move to a different location, maybe in Harare, but then we don't have the full history of that, of the previous scans. So which means at that new location, they have to start afresh. So we want to bridge that gap, whereby we want a longitudinal tracking of all the ultrasound scan reports that were done.
To just follow through, Angela, thank you for thinking the way you are doing, because this is what you want to see. But what you described here, you just described a digital patient case notes app, kind of. You've just digitalized case notes. That's what you have described. But we can see that what we want to do is we want to ride on the newer technologies is AI. But if you want this app to be an AI, then probably we need decision-making tools in the app. The app is to be able to help people to recognize that this Doppler is abnormal. And if it is abnormal, what is the next course of action? If the app is to have an impact on the things that we mentioned, like maternal mortality, perinatal, the app is to do more than just being a data storage app, which is now on the patient's phone. Because what you described is exactly that. It's just an application that is storing patient data, which some patients are holding in their hands. Right now, you will discover that our units are sending patients the report on WhatsApp, and people are keeping it's a digital kind of case notes. So the application cannot be like that. It has to do more. More so the fact that you put AI there, that means it has to help in the decision. If even a sonographer who doesn't know, or an ultrasound scan performer who doesn't know, if they measure the head circumference and they put it there, the app should tell them that this is a big head. And the big head, when you encounter a big head, please try to check for A, B, C, D, because big heads are caused by these are the common causes of big heads. When the application brings out the estimate of fetal weight, you should be able to tell the sonographer that, look, this weight is too small. Because the weight is too small, may you please go on and check these Dopplers. And if these Dopplers are abnormal, please refer to fetal medicine. This patient may need agent assessment, or please refer for agent delivery because of the findings that you put in the application. So that is what the application needs to do, to make sense. It has to have a decision-making tool in it. Without a decision-making tool, then it's just a data storage, and it's not going to change anything. Just that the patient, instead of carrying a bag of papers, now carries a phone. Right? But it's a great idea, but we need to improve it to that level if it is to make an impact.
All right. Thank you for that input.
Thank you for the presentation. I think the idea is a good one, and all things being equal, would like to advise our boss to partner with you in the development of this app, as I think that it's going to make a lot of differences in the way that we keep our data, and also the ability to retrieve the information from the app will go a long way in terms of research. So yeah, we want to partner with you in that regard. I think the pilot study, your sample size may be too low, since you'll just be capturing information. I think you can increase the pilot study population maybe to 200 to 300, because we scan a lot of women, maybe 20 to 30 per day. And in 10 days or just in 1 month, you'll be able to get that number. Also, 9 months, you said you'll be keeping the data for just 9 months. For obstetric patients, we may need to keep the data for a period that is longer than that, so that at any given point, we'll be able to retrieve the information. Thank you.
Okay, thank you for the input. But I'd say that the QR code will be valid for the duration of the pregnancy. but then the records, even the past pregnancies, will be able to store it in a cloud-based system for a longer period, such that if that woman decides to have subsequent pregnancies, we'll still be having the history of the previous pregnancies and the outcomes of that pregnancy, on what was done and what eventually happened. Did, like in cases of termination, or maybe the woman ended up miscarrying, the application will be designed in a way that it will be storing that information.
Yeah, my name is Dr. Klaichwai. I also think that it's a very good a very good research that you want to do. And as a way of record keeping is going to go a long way in this country, because often patients lose their records and we're not able to gather any previous history, any previous from the documents that will be necessary for management of either an ongoing pregnancy or some complication that might have occurred. But I just wondered, right now you're just talking about patients having miscarriages or some unfortunate occurrence in that pregnancy. Will there be a way of maintaining privacy? Who's going to be able to scan this? When we scan this, if a patient, for example, you said that's going to be kept on the patient scan report, then anyone can just scan it and see the previous history that I've had a termination, then also the miscarriage here, and this happened to me. So I'm not sure that might be an issue in terms of privacy. How are you going to make sure that there's this privacy? Is it how it's going to be accessed? Maybe just by clinicians, people who are relevant, or anyone can scan it. If anyone comes across the paper, they can just scan it and get all that information. Thank you.
Okay. As for data privacy, we are going to ensure that what the patient only carry with will be a QR code. And then the one who scans, remember, they also have to record their findings on the FETO app. So there will be different dashboards for the sonographer, the admin, and the area where there will be full patient registration. And then those dashboards will be having secure login authorization details. And then no one will just be able to access them. And in case the patient will change to a different facility, let's say that facility uses FETO app, before accessing those past records, there will be a one-time password that will be sent to the same patient or the admin of the FETO sync within the app. That is where we said that for this to function, the hospital will have to have a proper IT infrastructure. So as to cater for those data privacy and confidentiality issues.
Thank you for the presentation. Part of my question was answered by your last explanation, but I wanted to know at what level is the QR code assigned? Is it when the sonographer, the first sonographer enters the ultrasound report and the patient information? Yeah, that's what I wanted to find out. And I also wanted to find out how the next practitioner then accesses the QR code. Do they get it from the application, or it wasn't clear to me, since you also say that we are not doing away with the traditional report writing method, where there will also be a code on the physical report. Did I get that right?
Yes.
Yeah, so I just wanted to find out, do the next practitioner have to scan on the physical report And since we are saying it's been always a challenge, if they transfer to a different town, they won't be having that physical. Do they then get it from the application? How is that code then generated? Thank you.
Okay, so this for the next practitioner, it will be easier, especially if the facility has the fetal sync infrastructure, but they can, or okay, let's say the patient just comes and they do not have the fetal sync app. They will scan the patient records, but in order to access the previous records, they'll still have to send. There's an automated one-time password that they will have to send to the patient via WhatsApp or email. That one-time password will enable them to access previous records. But with the facility which already has the FETO IT infrastructure, they will be having hardware where QR code scanner hardware, which will automatically scan the QR code, and then it will be linked to and then it will be securely, it will be easily retrieved from the cloud-based system.
So I'll entertain probably two more.
My question is short. We currently have electronic health records. I wanted to find out whether you have any intention to write on pre-existing infrastructure, especially on clinical history, because us being sonographers, the way we take history and the way clinicians do is different. Thank you.
Okay. Okay, so you were asking if you said you have your own way of taking history at, okay. Okay, all right, I'm going to give an example about fetal medicine. So you have realized that with fetal medicine, the first thing that they do is taking history, that full patient history. So this research was designed to take that full patient history, regardless of whether we want it for performing the ultrasound scan or for anything else. Like if the patient has taken lab tests, we want to take that history down, which ones and why, the previous interventions which were done for the previous pregnancies. That is what we want to be looking at on history. We want to take the full patient history that will be needed either by midwives or sonographers associated with that pregnancy. I'm not sure if I've answered your question. We wanted to make it focus on obstetric ultrasound, which means it has to, we want to promote uniformity of prenatal care in all the healthcare facilities in Zimbabwe. So, of course, it would have started at fetal medicine, but we want it to be slowly adopted by the other healthcare facilities.
If you don't mind, I just wanted to come in there and say, the reason why we are here, and probably we are going to be here many years to come together, is because we want to bring uniformity. Because the patient we are trying to help is the same patient. So history should be taken, let me say, the same way. I know right now it's not what is happening, but that's not the future. The future is that it doesn't matter who has taken history, all the relevant history should have been taken. Because come to think of it, if you say you do not take a history, somebody's been taking angiotensin converting enzyme inhibitors, and you didn't take that kind of history, you're going to find a baby with oligohydramnios. How are you going to interpret the findings? Because you didn't take a history. But if you had somebody who take history and they tell you, look, I've been taking these drugs and the baby's kidneys have dried up, now you can explain why there's no oligohydramnios. I know the teaching that has been happening is that people just scan. After scanning, then they say, go to your doctor, and your doctor is the one who's going to explain things to you. But that approach is wrong, because the doctor you are sending the patient to go and get explanation doesn't know why that fluid is dried up. The best person to explain why the fluid is dried up is the person who has scanned the patient, not the doctor writing the report. Because I became an obstetrician without knowing how to hold an ultrasound. Myself, as an obstetrician, I didn't know how to even hold the ultrasound. I almost became one. Okay, I almost became one. Without even knowing how to read a single ultrasound. But people who would scan for us would expect me to know how to read the report, which is totally absurd, really. To say, you've never seen anything, you've never been taught anything, but someone, somewhere, expects you to be able to interpret what they've written. So this is why we are here. We are here because we've realized that working in silos doesn't work for the clients we are trying to serve. So we want to bring uniformity in the how people scan ladies, that we should take history, and that history should be standard and be the same. This is where she's coming from, to say we want to standardize the way ultrasounds go. It's good for everyone at the end of the day, because it will make life easy. Thank you.
Just one last one. Don't worry, the chair is in control.
Thank you very much, Angela. I think the reason why you're getting so many questions is that your proposal is very good. It's a very great idea. So don't take it on the negative side. So I will also add to the questions meant to improve probably on your proposal. Like what you said, I think one of the ideas is to introduce uniformity of prenatal care between facilities. My question is, yes, the app is going to be there with the checklists, with all that people are supposed to enter. But how are you going to address the human aspect, the human factors aspect? The app may be there, but I'm sure most people who are in this room probably appreciate the contribution that fetal medicine is made on them. Someone who may be in Peru, Pashingo, Shawan, yes, they may be a sonographer, but they may not necessarily be able to perform similar to a sonographer here in Harare. So my question is, how are you going to address the human factors there?
Okay, to answer that question, remember these are just standardized templates, so which means they are editable. But then they, on the long run, they must serve as a guide to what this is for example, like many radiographers, they do obstetric scans and also midwives. most of them, they are not exactly trained on, let's say, I'm putting an example, say for 11 to 13 weeks scan, this is exactly what you are, by protocol, this is exactly what you are supposed to write on your report. So to address those human factors, I think this will serve as a guide as to what they should adopt as the norm that will help the patients in the future, not just to normalize substandard reports that we normally see. I don't know if I have answered your question, but the templates are editable, as I have said.
Probably what I was asking is probably the people going to be trained. That's the human factor is asking about.
Okay. All right. All right. So within the research plan, there's also training. So there will be also training within the phases of our research. We'll undergo the training where we'll be training the midwives, radiographers, and sonographers.
All right. All right. Thank you. Thank you. I think you have